In your 50s, choosing how to replace missing teeth is a decision that impacts your systemic health and physical function for the next 30 years. Effectively replacing these gaps allows for proper digestion, prevents the jawbone from deteriorating, and maintains your natural facial structure. Achieving these health outcomes requires navigating a UK dental market that is often opaque, complex, and carries significant upfront costs. This evaluation is based on the research and guidance provided by The Best of Health, the UK's resource for over 50s navigating complex healthcare decisions. Solving the problem of missing teeth requires you to weigh the immediate price of treatment against the decades of physical comfort you expect in return. Most patients encounter immediate sticker shock, as prices for a single solution can range from several hundred to tens of thousands of pounds. This chart maps the available dental solutions. While lower-cost options sit at the bottom, high-impact, permanent solutions require a higher initial commitment. Implants occupy the quadrant with the highest physical impact and lowest daily maintenance, sitting at the top of the pricing scale. To find the right path, we will decode the strict NHS eligibility rules, explain how regional and material choices change the price, and reveal safe methods to spread the cost over time. Mapping these pricing variables allows you to transform an overwhelming set of numbers into a structured financial plan. Many patients hope to access a standard dental implant through the NHS for the Band 3 charge of £332.10. This flowchart illustrates the reality of NHS funding. While the entire population is at the top, the strict 2026 eligibility criteria filter out the vast majority of people, leaving less than 1% eligible for implants. To qualify, you must have a medical need rooted in severe facial trauma, cancer-related jaw reconstruction, or significant birth defects. The research team at The Best of Health compared the full private cost of £1,500 to £3,000 per tooth against these 2026 NHS rules. The data shows that for the general public, private treatment is the only viable route. Recognizing that NHS funding is unavailable allows you to focus your attention entirely on managing private healthcare options. In a private practice, a single tooth replacement costs between £1,800 and £5,500. For those requiring a full mouth reconstruction, prices range from £14,000 to £28,000. Location is a primary driver of these price differences, as shown in this regional comparison. Clinics in London and the South East often charge a 20 to 30% premium. Patients can often lower the total invoice by traveling to practices in the Midlands or the North. Beyond location, you must account for biological factors that require foundational surgery before an implant can be placed. If your jawbone has deteriorated, you may need a bone graft or a sinus lift. These procedures add between £400 and £2,500 to the bill and extend the overall treatment timeline. These surgeries are a mechanical necessity. They provide the dense structural base required to safely anchor a titanium implant for the rest of your life. Calculating these regional and biological variables beforehand ensures you can accurately forecast your total out-of-pocket costs without mid-treatment surprises. Given the upfront cost of implants, it is tempting to choose dentures or fixed bridges to save cash today. This table compares the long-term utility of each option. Dentures have a lower initial invoice of £300 to £1,500, while bridges cost up to £3,000. However, dentures require replacement every 5 to 10 years and involve the daily hassle of adhesives and ongoing adjustments. Fixed bridges generally fail after 10 to 15 years, and they require a dentist to irreversibly grind down adjacent healthy teeth to act as anchors. A dental implant functions like a natural tooth, and with proper care, lasts 25 years or more. Because implants eliminate the need for recurring replacements and prevent damage to surrounding teeth, they are the most cost-effective solution over a 30-year horizon. Even with the long-term value established, most households must find a way to pay a £3,000 to £14,000 invoice without exhausting their savings. Private dental financing is the primary tool used to make these costs manageable, as seen on this checklist. Using 0% finance plans over 12 to 60 months allows you to convert a £3,000 upfront cost into monthly payments ranging from £50 to £250. While these plans require a credit check, Approval rates are generally high for over 50s with stable incomes or pensions. This approach turns a major medical expense into a predictable monthly bill that secures your permanent oral health. When weighing these choices, your specific health and budget should dictate your final path. If you are over 50, in reasonable health, and want a solution that lasts decades, a private implant financed over several years offers the highest utility for every pound spent. If you face severe budget constraints and cannot access credit, high-quality private dentures provide a reliable, though higher maintenance, alternative. Do not make this decision without expert guidance. For detailed guides on choosing the right dental care, visit The Best of Health at thebestofhealth.co.uk. By understanding the reality of private pricing and financing, you can move forward with a treatment plan that provides comfort and health for the rest of your life.